Hello, everyone. Thanks for joining us today. I'm John Sturgeon. I work within the marketing department at Brunel University London. I'd like to welcome you, wherever you may be in the world, to our webinar for the launch of 3 new online public health postgraduate programs. So the new programs we're launching and which we'll present about today are called the Master of Public Health, the Global Public Health and Social Justice MSc, and finally the Public Health and Behaviour Change MSc. So today you'll get the opportunity to hear from our academics who have not just played a very important role in creating these courses, but will also use their years of expertise to teach you so that you get a really valuable learning experience at Brunel. So our academics who are in attendance today are Dr. Nana Anoke, Dr. Emma Norris, and Dr. Elaine Garcia. So they will present further information about studying these courses at Brunel and also the range of career opportunities that can lead to once you graduate. After their presentation, it'll be your opportunity to shine, so you'll get the chance to ask them any questions you may have. So let's find out a little bit more about our academics who are presenting today. So we have our first presenter will be our lead academic, which is Dr. Nana Anoke, and he is basically the Director of Division of Global Public Health at the Department of Health Sciences within the College of Health, Medical and Life Sciences, also known as CHIMLS. So Nana has a PhD in Health Economics at Brunel, an MSc in Environmental Management from the Brunel University of Technology, and a BA in Economics and Sociology from Kwame Nkrumah University of Science and Technology in Ghana. He is also a member of the African Research Excellence Fund, College of Experts. And our second speaker will be today Dr. Emma Norris, who is our Academics and Admissions Tutor. So Emma is the course lead for the Public Health and Behavioural Change MSc, one of the new online programs that we will be launching today, also in the same Department of Health Sciences within the College of Health, Medical and Life Sciences. So Emma is quite experienced and has a PhD in Health Behavioural Change from the University College London, an MSc in Health Psychology, also from the University College London, and a BSc in Psychology from our very own Brunel University. Finally, she's a member of the British Psychological Society and a fellow of the Higher Education Academy as well. And our final academic speaker of the day will be Dr. Elaine Garcia, who is the head of academics for Brunel Online. So she has a PhD, MBA and BSc, all from the University of Plymouth, and has worked in education for over 20 years and taught both online and on campus for a range of universities across the UK and Europe. Dr. Elaine Garcia is also an active researcher and associate fellow of the Higher Education Academy. So with the introductions done and with further ado, I will now forward you on to our first academic, Dr. Nana Anoke, who will tell you more about our exciting new online public health postgraduate programs. Thank you.
Okay, thank you very much, John. And a hearty welcome to all of you. A nice meeting you. E-meeting you, I should say. So I think you might be asking yourself this question: why do you need to choose Brunel University after all for an online MSc? So at Brunel, we noted for a number of things are positive though, but the key among this is we noted for a strong track record of providing online programs and actually been doing this since 2019. In terms of research, we currently sit in the top 25% of UK universities. And for diversity, when you come to Brunel, you're likely to see over 150 world countries represented at Brunel. So we have huge presence in Africa, the Americas, and the rest of Europe, actually we dotted all around the world. So you're going to learn about different cultures, both during your program and also develop a number of networks in the course of the program or after that. Okay, and currently, I think as John has alluded to, currently we have on offer in the Department of Health Sciences, we have on offer 4 programs. The first among which is Master of Public Health, and I need to say this is not in any order of priority. We also offer Masters in Public Health and Health Promotion, and then we offer Masters in Global Public Health and Social Justice, and the Masters in Public Health and Behavior Change. In the following slide, I'm going to tell you a bit more about that. But we have 3 entries. So you can decide to enroll in this course in January, May, or September. And you can also choose from doing the course both as full-time. And when you're doing full-time, then it means you'll need to spend a year doing that. And if you like to do it as part-time, then it's just 2 years doing that. Okay. The fees, which will be our fee standard across all the 4 courses, is £9,810 annually to do the whole program. So if it's full-time, it's that, and if it's part-time, then it's a split of that. But your total fees will be 9,810. So let's find a bit more about what these programs are. And remember, the 4 programs are Master of Public Health and Health Promotion, Global Public Health, and Public Health and Behavior Change. Now, before the introduction of these 3 new programs, as I said, we've been running our online program since 2019. And the program that we'll be running, has been a Public Health and Health Promotion MSc. This course will be running for full-time, it's been 1 year, and for part-time, it's been 2 years. And the course has been structured. So we offer a modular system. And the reason for offering this modular system is to allow students the flexibility to, undertake modules, and probably a student might even want to take a break, or there might be some specific modules that you might want to schedule and all that. So in the Masters in Public Health and Health Promotion, we offer 9 compulsory modules, and this includes a research project. Now, research projects, we're fully aware that as students, one of the key things you'll be thinking about is what next after. Now, if in case you want to, let's say, move into academia or not, you may still need to demonstrate your currency. And I always say this, a currency of having a master's program is having a publication. So unlike other programs where you have, for your master's dissertation, you need to write about between 15,000 and 18,000 words, ours is a bit more of a manuscript style. And the idea is that after completion of the course, then you have something handy to get out with your supervisor to submit for a publication. Okay. Some of the programs we offer in the MS in Public Health and Health Promotion include health economics, implementing change. We also offer health promotion. But then at this moment, I think I will stop, and Dr. Emmanuel will come in to give you further details on all the portfolio programs that we do offer. So over to you, Emma.
Thanks a lot, Nana. So yeah, as Nana just mentioned, I'm now going to talk you through each of our new 3 programs, which build on the successes of our Master of Public Health and Health Promotion, which has been running since 2019 online. So all of these are online courses. So what I'm going to talk you through now is what the different modules are within these courses and how they're different, and the various skills that you would gain undertaking any of these separate courses. So to reiterate, we have a Master of Public Health, MSc Public Health and Behaviour Change, and an MSc Global Public Health and Social Justice. And with all of these programs, they again have a 1 year full-time or a 2 year part-time option, and we run them 3 times a year. So you can start in September, January, or May. We are now closed for September entry, so you cannot apply to start for this September now, but you're very welcome to apply for January, May, or even September 2022 for any of these programs. So let's begin with the Master of Public Health. And now this really is designed to give you a very broad introduction to the various areas of public health. And I'll talk you through those modules in a moment. Alongside this, you're also really going to get good exposure on how to manage teams within public health. We find that some of our students want to go on to become public health consultants, for example. So that involves leading teams of people to develop interventions or to evaluate the success of public health programs. So we really embed some leadership training as part of this specific master's course to help you do that. And this course also really gives you a broad interdisciplinary overview of public health, and you'll see that in a moment. So yes, we're covering things like health promotion, but also we're covering things like epidemiology. So how we can look at the data to tell us how a disease may be spreading, for example, in the case of COVID-19, or how specific health behaviours might be patterning in a group of people, such as physical activity or diet, for example. So as I said, it's a really multidisciplinary course, And with all of our courses, we say that they're suitable for students from either a clinical background, so you may already be practicing as a health professional, for example, or from a non-clinical background. So perhaps you're coming from a relative undergraduate straight away, that is fine. Or perhaps you're coming from a kind of related academic career that may not be clinical, or a kind of non-related course. So we really look at your application as a whole for all of these courses. We want to see perhaps some academic experience that you have related to health, or some work experience that you may have. We typically, in lieu of a relevant degree, we look for approximately 2 years of relevant work or volunteering experience related to health for all of these courses. So that just gives you an idea of kind of what we're looking for as part of the admissions for all of these courses. So here are the modules for the Master of Public Health. With all of our courses, all modules are compulsory. So there are no optional modules. You would do all of these as part of your Master of Public Health. And as you can see right at the top, as I mentioned, a module in public health leadership. So that gives you the skills to manage teams across local, national or international groups of people. Many of these modules that I'll explain here now are also seen in the other courses that I'll explain afterwards. So I'll take a bit more time here just to talk you through each of these modules, so you can see how they also appear in the 2 other courses that I'll explain afterwards. So in the second bullet point, you see we have research methods. Now this is to really give you insight into the quantitative and qualitative methods that you may be using as a researcher or a practitioner in public health. So you'll really go into detail about how to develop a research proposal and how to evaluate the processes of a given research project. We also have epidemiology, so that's really to understand the kind of ebbs and flows of disease and non-communicable diseases within different groups of people. We also have health economics, so that's to understand how we can assess things like cost effectiveness of interventions. We also have health policy, politics and social justice, and we have a lot more of this in our Global Public Health and Social Justice MSc that I'll explain a bit later. But this is really getting us to think about how inequalities can manifest in terms of public health. So looking at things such as racism, sexism, etc., and these types of inequalities. We also have health and society, which appears in many of our other courses as well, as you'll see a bit later on. But this is, again, really thinking about how we can kind of benefit public health in terms of different demographics of people in our society. We have global public health, so thinking about how we can design different initiatives and evaluate these depending on different geographical aspects. We have a behaviour change and intervention design module, so really getting you to think about how to design in a lot of theoretical kind of detail, but also in a practical way, interventions to improve public health from a behavioural perspective. And finally, as Nana mentioned just now, we also have a research project or dissertation, which is a project of up to between 3,500 and 5,000 words on a project of your choosing. So moving on to our second master's, which is an MSc Public Health and Behaviour Change course. And this is the course that I run and developed. So the difference with this course is that it's very much more focused on the psychological and sociological perspectives that influence our health. And it's also driven from a really theoretical perspective, thinking about the concept of behavioural medicine. So how does the kind of society and culture that we live in influence our health? How do our individual interactions between people influence our health and health choices and health behaviours? So again, this is a multidisciplinary approach to a course with influences from, yes, psychology and sociology, but also from really kind of public health and health promotion perspectives as well. And again, suitable from students from clinical and non-clinical backgrounds. So you'll see a lot of similar modules here, so I won't go through them all, but I really want to focus on the top 2 modules here. So behavioural medicine, you'll basically be thinking about the range of health behaviours that we see patterning in society. So things like physical activity, for example, but also relating to communicable diseases, such as things like vaccine uptake or medication adherence as well. So thinking about the different factors that can influence an individual's behaviour to participate in these behaviours. Why do they make these choices and why do they not make these choices? So really from a kind of psychological perspective, we'll be exploring in this module. And the second module is theories of behaviour change. So this does really take a multidisciplinary perspective. We look at and evaluate theories from psychology, sociology, and economics primarily to understand the reasons why people engage in health behaviours or not. And so this draws from a range of global theories that have been used over recent decades, but also theories that have been more recently developed and trialled with success. So you'll be thinking about how to evaluate which theory might be suitable for you if you're thinking of designing an intervention, for example. And we'll talk you through in this module the steps of how to develop an intervention that's based on a theory. So that's an overview of the MSc Public Health and Behaviour Change. And finally, we're also launching an MSc Global Public Health and Social Justice. So this MSc is really designed to get you thinking a lot more about the determinants of health from a social justice perspective. So thinking about this also from a context of global public health. So we're not taking a UK perspective in this or any of our courses. We try very hard to give lots of case studies and lots of examples from all the different continents of the world. So wherever you are in the world, you'll find something that's really relevant to your culture as part of our course. And we also, in this programme, really are looking at the key aspects of racism, sexism and privilege and how these affect individual, local and national health. And again, as I've said before, with all our courses, suitable for students from clinical and non-clinical backgrounds. So again, there's a lot of overlap with some of these modules, but the top two are ones that I really want to focus on for this module. So we have a new module that's specifically on social justice and health. So that is purely focusing on the various privileges and lack of privileges that influence on public health, critiquing why they occur, how long they've occurred for, and what we can do to break these privileges in the benefit of public health. So all of this is very much from a health perspective rather than, for example, an economic perspective, but really critiquing how these privileges over the life course perspective can have a real influence on our health in many different ways in terms of our physical and mental health. And additionally, the second module that you won't have seen before here is the leadership and change for global health module. And again, this is really taking a leadership and management perspective, but really focusing on this in terms of managing global health teams. So whether that be teams that are focused in different countries internationally, or whether it's kind of a global effort that's fighting towards a specific problem that is at a global scale. So you really get to think big in this module in terms of the reach of the kind of programs that you're thinking of working on, but also in terms of your leadership potential in the future and your future career, whatever that may look like in the future. And again, with all of these, we have a research project dissertation for this master's and all of our masters, which, as I said before, is a project of your own design, which is 3,500 to 5,000 words long in a report. So just to give you, as I end this section, an overview of what our various modules are across all of these courses, just so you can see where you might be most interested in applying for. So the courses, the modules in bold are the additional new modules that you'll see for each of the new courses. So we have our existing MSc Public Health and Health Promotion on the left-hand side there, which has already been running for a few years, and our new courses in the second, third and fourth column. So we can also come back to this in the ending questions if you'd like to look at this a bit more and have a bit more discussion about what these modules actually contain. So that's it from me for now. So I'd like to go over to Elaine to finish the next slides. Thank you.
Yeah, sure. Thank you very much, Emma. Welcome, everyone. Nice to see you all. Hopefully you can hear me okay. So I'm going to talk a bit more about how the course is actually taught and how the structure of the programme works when you're actually on it. So we talked earlier, Nana and both Emma mentioned about time and part-time study. And when you're a full-time student on this master's online programme, you'll be taking 2 modules at one time. and part-time students will undertake one at a time. So the structure is the same, essentially, for both the full-time and part-time programs. It's just that the part-time program does it in half the time that the full-time does. So full-time in 1 year, part-time in 2 years, and either 2 or 1 modules at a time. So it's quite important to think about which is the best mode for you, but you do have the option to move between full-time and part-time, or part-time and full-time, once you're on the program, if that's something that needs to happen. All of our talk modules are delivered first before the research project dissertation at the end. Each of them is 15 credits, so you have 8 modules that are in the tools element, and each of those runs for 6 weeks. The order in which you take the modules will depend on when you start, so whether that's January, May or September. We don't have a fixed order to our modules, so you come in at the time of year and whichever of those modules is running are the ones that you start with. But you will do all of the talk modules before you start your dissertation anyway. Each of our 6-week modules contains 1 unit per week. And this will include a range of different activities. So that will include pre-recorded mini lectures, and I'll talk a little bit more about those now. So in these pre-recorded mini lectures, these are written by Brunel faculty. They're then given to our e-learning team, who then creates online interactive materials and also creates these online lectures for you. They're professionally recorded, and we have some discussion about how people like these, but we think that at the moment this is the best way for us to deliver some of our concepts and theories that you need to really take notice of in this course. The lectures are kept quite short, and they're generally between 5 and 10 minutes, because that's the amount of time that generally you can concentrate for. So there's a series of different mini lectures you can watch all at once or over the course of the week, or revisit, and that allows you some flexibility in when you can watch those, and you can take notes or look at the content afterwards, which is available in a PDF, revisits the points that you think are really important. On top of that, we then have online reading and resources. So part of being a master's student is that you need to be very self-motivated to do lots of your own study, of your own reading, but we have all of the tools available for you. So you'll find a reading list for each module that has core reading and recommended reading. The core reading is that which you should really take notice of. Recommended reading is there for additional information about certain subjects. You also, however, have complete access to the online library, and you can look at the different resources that are available there and really start to look into your own research and start to look into areas that you find particularly of interest, or you maybe have more queries about. In each of the units, we also have a number of activities. So that could be a discussion forum, it could be a quiz, it could be some other type of task. But this is really to apply what you've been learning about in that unit to a practical situation. So it could be that you're asked to talk about your own experience. It could be that you're asked to reflect on a case study or a particular issue or topic. And what's really nice about being online is that you have this global community, and you'll be interacting with people from different countries, different backgrounds, different types of work you're interested in, and you really can share a lot of experience that you have with others from very different cultural and organizational backgrounds. So it's a really nice way to be able to get some of that experience. There also is in each unit, well, not in each unit, in each module, a number of live sessions. So it may not be every week. It will depend on the module, but we do some live sessions with your module lecturer. Now, your module lecturer will be there for the whole of the module. They'll talk with you in the discussion forums. They'll be available there for any questions you have. And they'll also then do live sessions where they'll either talk about the assignment or a particular concept, or provide an introduction to your module. And there you can ask questions and interact with the lecturer. Because we have people all over the world, we record these sessions for you. So if you're not able to make that session, you can always watch it afterwards in the recording that's made available. So there's a whole range of different types of learning experiences there. There's a range of different ways in which you can interact with the content. It's mainly asynchronous, which means that you can study at your own pace and review that content when you want to. So there are no deadlines until the final assessment deadline. So we suggest you look at that as 1 unit per week. But if you want to focus on getting through the materials quicker or slower, that is entirely up to you. So you have flexibility, but you also need to be self-motivated, as all master's students need to be. Okay, so we'll move on. And the next element after you've completed all of the talk modules will be the research project. And as both Nana and Emma have talked about, for this programme, on all of the health programmes that we've got online, this is, rather than a 12,000 word dissertation, 3.5 to 5,000 word paper that's ready for publication. If you're a full-time student, you'll undertake this project in 4 months. And if you're a part-time student, in 8 months. So again, the part-time is twice as long as the full-time programme. This is a really interesting way of doing a final project, because it's not often in your working life or in an academic life that you'll be asked to write something that's 10 to 12,000 words. You'll typically be asked to write for publications, and that will be between 3.5 to 5,000 words. So you're getting some really useful practical skills in doing this rather than a big dissertation. And some students come in and feel disappointed that they're not doing a big piece of work, but this is a really, really relevant thing to be working on. And at the end of your programme, if you've done the work that is of sufficient standard, you can seek to get that published, and your supervisor would work with you to do that. And that brings me on to how we support the project. So everyone is assigned a supervisor who will work with you on a one-on-one basis to complete your project. They'll be assigned based on a research proposal that you've completed during one of the talk modules, so a bit earlier, and they'll be assigned to you based on maybe your methodology or the topic. It'll be a particular interest of theirs. They'll also help you with research ethics, which is a really important area in public health. So you need to also think, when you're considering a dissertation or a research project, of what you might like to look at, but also think about what might be ethically available to you. So there are some subjects in public health that can be more difficult than others. There can be some situations around the world where it might put you in harm if you were to do certain topics. So you really need to think quite carefully and work with your supervisors and the research project teams to be able to think through your idea and just make sure that it's going to keep you safe and the participants safe. But we provide training in all of that sort of area. And then once you've done that, those skills will stay with you throughout the rest of your working life, which is really useful to have. If we just move on to the next one. So I know someone asked a question in one of the question and answers, and I might cover some of that here, is about careers and your future. So this programme, and Emma's mentioned as well a bit before about the areas that you might want to go into, and leadership is a really important topic for a lot of the students that come to our programmes. And so that is certainly something that a lot of people will be looking for and will feature across our programmes. When I talk to students, a number of them are saying that they're doing the Masters because they're interested in moving to a management position or a leadership position. And that can be a really useful way to show that you've got skills and to develop your toolkit, really, for being a leader in the future. We have a range of students who are currently in public health or want to get into that area. So it can give you options within the public health range of different options. It might be for healthcare and social care. It might be the voluntary section, NGOs, government. You might come from a medical background, you might not. So there's a whole range of different areas that you can go into through this programme. And you'll have seen in some of the modules, they give particular areas that you can focus in as a career later on. Our graduates typically go on to work within organisational, community, partnership or strategic development, health information strategy, academia and project management. And a number of our students also say that they'd like to carry on to do a PhD after they've completed this programme. And again, having the research project and a publication can be a really strong feature to take forward if you are looking to do a PhD later. So a range of different careers available. There's lots of career support on the website and on our intranet. And you'll really find that your lecturers can also really help you explore some of those different areas that you might want to work in the future if you don't already know where you want to focus your time. I think that's my last slide, so I'll hand back to John.
Thank you very much, Elaine. So yes, that covers all the academic part of the presentation. So just a little opportunity here for Brunel to talk about our various social networks, where you can find out more about Brunel as well as all our courses on offer. So we, of course, we have an Instagram group, Snapchat, Facebook, and Twitter, as well as LinkedIn, which you can't see on there. But join us if you want to find out about the latest development from Brunel. So just before we start the questions, we had a couple of issues with Nana's sound quality. So I was just wondering, Emma, if perhaps you could present a couple of the slides that Nana presented at the beginning, just so it'd be a good opportunity to cover those areas again, of course, and also just to kind of make sure everyone can hear them fully this time as well. So it's just a few slides, I think, about the structure of the program. So I'll let you take it away.
Okie doke. So, okay, so I think Nana was speaking to this slide originally. So around, Brunel University as a global university and our track record of providing online programs. So, to rest assured that we have a strong history of doing this already, that we're building on with these 3 new courses, and that we kind of have a really good global perspective in terms of research and the representation that we have globally, online and on our campuses. This here, I guess we could also speak to now as well. So just to reiterate that we have 3 intakes a year, January, May and September, for all of these courses. And so we've mostly spoken today about Master of Public Health and Social Justice, and Public Health and Behaviour Change. But we already have an MSc Public Health and Health Promotion that's been for a few years. You can study 1 year full-time or 2 years part-time, and the fees that you see here, 9,810, are the same for all students, no matter where in the world you're studying. If it's part-time, that fee is breaking up over 2 years. And yeah, we've spoken about this already, so that's our existing program. And then I went on to explain all the different programs. I can leave this up if it's of interest. So this is our module breakdown by the various courses there.
Thank you, Emma. Yes, I think it's a good slide to have up on the screen while we take a few questions from the audience. So let's do exactly that. But just before we do, actually, what I will say is if you have seen enough information, you like what you see, and you're ready to take the plunge and apply for one of our courses, you can find a link on the chat section, which is the link beginning with enroll.online. So you can click on that link. It'll take you to our dedicated website, which has all these programs. And of course, it'll have an application link on there. So you can apply today and we'll be in touch. So just before we go on to that, let's take a couple of questions. Now, for the sake of privacy, so to say, I will not read out the people's names who are asking the questions, but I will read out the questions and one of our academics will answer them for you. So let's take the first one we had today. So this is a potential student from Nigeria who said she has a degree in agriculture, economics, and extension, and does not have any volunteering experience. So she asks, would she be eligible for the MPH? Which is
yeah, I can speak to that. So we would encourage you to apply. The reason being that we look at the transcripts that you have from your degree. So we see what modules you have that may be relevant to the course. So I would not say we would accept or reject. We'd need to see a bit more information before we make that decision. So yeah, we typically ask for a degree that has some health content or some social sciences content, for example. So yeah, I'd encourage you to apply. The process is very quick, and we can provide a decision on that. We can also come back to you with more questions and to ask you more if we need to. We also ask you to provide a personal statement as well, so we could see the rationale for why you're interested in the course and the healthcare programme. So that's the same for all of these courses. So it's the same admissions criteria for whichever one you choose.
Thank you. The last end of that part of that question, actually, and there's another question related to this. Somebody's asking if they heard you correctly. Do you need 2 years of voluntary service or volunteering service in public health fields, in order to be admitted to this program?
So we ask for 2 years of work experience. The reason why I'm saying voluntary as well is that we understand that for a lot of people, they may have been not able to secure paid work that's relevant to this field, and that's why they need an MSc like this. So we try to be as flexible as possible. What we're really interested in is that it's specifically, human health, that it's not necessarily, we're not looking at kind of animal health, for example. We do get people that work a lot in specific fields like veterinary. So we're trying to make sure that you have some experience and interest in human health, as that's the focus of this course. So as I'd say to everyone, is do apply, because we take applications as a whole, really looking at your academic and your work experience, as well as your rationale for wanting to do the course. John, you're on mute, sorry.
Apologies about that. I was just saying, we had a question which actually Elaine answered live on air, which was, what is the career pathways for public health and behaviour change MSc? Is there anything additional you want to add to that, Emma?
Yeah, I think, so obviously this is a new course, so we don't have data on our own students progressing, but just from my experience working in health behaviour change and having taught on other programmes that do so, we see a lot of our students go on to do a really wide range of different jobs. So, for example, because we're really focusing in this course on intervention, development and evaluation, there are lots of different types of careers you can go into. So, for example, some, yes, go into academia, but also into industry as well. So there's a growing demand for intervention, evaluation, whether that be in the health sector, in the technology sector. So colleagues of mine previously have gone onto Facebook and Google, for example, because they have health areas that they're interested in within those companies, but also charity organisations, as well as local, national and international governments and organisations, NGOs, for example. So it is a really hot topic, behaviour change. There are an increasingly wide number of roles that are specifically labelled as behaviour change specialist or behaviour change consultant. So we're really passionate about this course as really filling a need, because there just aren't many behaviour change courses at the moment. So we're really trying to plug that gap with a course that's specifically related to healthcare and health provision. So yeah, we're looking forward to seeing the great careers that our students go on to as part of this new programme.
Thank you very much. So just, we have quite a few questions coming in, which is great. So just before we go on to them, just another opportunity for me to say, if you are interested in applying for one of these courses, you can do by clicking the link on the chat side of this webinar. So the link begins with enroll.online. So if you just click on that, it'll give you more information about the course, of course, and she'll have a link there where you can apply for one of these courses today. Right, back to the questions. So very good one actually is, somebody has a full-time job. So they're wondering how much time do they need to put in to complete the course? So essentially what they're asking is, would they be able to do the course alongside their job?
I can probably take that one. So we have lots of students that are working full-time and doing the programme. You need to think quite carefully about what's the right route for you. So we do have students that are working full-time and studying full-time. It is quite a commitment though, so just think very carefully about whether full-time is right or whether part-time might work better for you. Generally, we would say that you need to treat full-time study as if it was a full-time job, so it's about 40 hours a week, and part-time will generally be about 20 hours a week. Now, it really depends on how much effort you put into your programme, because it's a very self-motivated thing studying a master's. So that can be different depending on what you study, how much you know already about the topic. So it's a very general rule, but we do have students studying full-time and working full-time, but do think very carefully about the commitment you're making before you make any decision. That would be my advice.
Thank you, Elaine. That's very good. And just to pipe in, somebody who's a former online student himself, I completed my online degree a couple of years ago. I'd say you have to treat it like an online degree like you would do an offline one. So dedicate a day where you are going somewhere where you can study quietly, you know, a library or maybe a quiet room in your house. Dedicate a day where you can go and just have all that time to yourself, where you can study, focus on your course, and yeah, it's a good way to get a lot done in a solid day or any particular time slot that works for you, really. Okay, so back to the question from the audience. So this question doesn't refer to one course in particular, just the online courses. So maybe we might be able to answer generally towards all courses. So the question is, will there be an on-campus learning option for 2022? If yes, how's the application process requirements work?
That's a fantastic question. So we already have an on-campus version of our existing MSc Public Health and Health Promotion that runs commencing every September. So you're very welcome to apply for that course in 2022. We don't currently have plans to run any of our new courses on campus, but that does not mean that we may change our minds and do that in the future. So for the moment, if you're really set on campus, I'd encourage you to apply for the public health and health promotion. But we've really taken a lot of care to really make our online courses really engaging and beneficial, as you can study in your own time and you're not tied to a timetable, for example. So no current plans, but we may definitely consider it in the future.
Thank you, Emma. Okay, so our next question is actually coming as two questions. So it could be referring one module or two. So I'll just read it out. Do you have a module related to project management and health protection? So that's either one module, project management and health protection, or two modules, project management separate, health protection separate. So do we have these modules, especially after COVID?
Yes, I think, again, really great question. So in terms of project management, that's really quite well reflected in our leadership modules. So you can see those across our 3 new courses, and that's kind of purposefully done to reflect the need to manage the sizes of teams as part of professional development. But that also includes project management in terms of managing specific projects, but also in terms of managing the teams within those projects. So that's reflected there. The question has gone, but I think it was on health protection, which is a good question again. So we don't have a specific module on that, but it is reflected in the vast majority of these modules in itself. So we do have case studies surrounding health protection in our health promotion and our health and society and global public health modules. So whatever course you study from this, you will get experience and case studies and time to think about health protection in those different contexts.
Thank you very much, Emma. Okay, so our next question is, can an online applicant for the Masters of Public Health have access to scholarships, and what are the fees for online and on-site programs?
So for the MPH, we only offer online version of that course, and it's £9,810 for the single year program. We occasionally get offers of scholarships, but they tend to be for our on-campus program, which, as I said before, is currently only our MSc Public Health and Health Promotion. We don't currently have scholarships for the online program. Nana can correct me if I'm wrong on that. But my understanding is we don't have scholarships for the online programs at the moment. The price for the on-campus MSc Public Health and Health Promotion, I can get back to you with a definitive number, but I believe it's around 18,000 for international. But let me look that up while you do the next question, just so I can be sure.
Okay, and just to add something to what Emma said regarding the fees. So at the moment, we're in the process of arranging something for students coming from LMIC countries, particularly Africa. So I would say keep watching or keep in tune into our website. And if there is any updates, I think we will let you guys know. But at the moment, there are no scholarships for online programs, although 1 or 2 might be coming your way shortly. Thank you.
I've got the fees. So for the on-campus MSc Public Health and Health Promotion, it is £8,485 for a UK student and £19,855 if you're international. So bear in mind that our online programs are 9,810. So if you're coming from an international country, our online students have really fantastic support and the flexibility. You don't have to move house, etc. So just consider it as a really great flexible option. You end up with a degree the same as all of our other students from Brunel University London. It's not a different standard of degree. It's the same level of degree, just you've done it online.
Absolutely. Very, very important point there, Emma. So just to emphasize that whatever course you do online, on site, you will end up with the same prestigious degree from Brunel University London. So it's something to consider into your thoughts before applying to Brunel. Okay, the next question is, each module has an assignment at the end and courses end with the research project. So does this mean there are no formal exams? And I'm assuming that's across all the courses.
I can take that one. So yes, there are no exams. So everything is assessed by an assignment. There are a range of different assignments. So you might do an essay or a case study. There might be a SWOT analysis. You might do a presentation. But we try to keep it fairly straightforward, not overcomplicated, but no exams. So you hopefully will find a good range, but you don't have to do any online exams.
Thank you, Elaine. I think we have another module related question here. I think it was somebody saying if by any chance you joined late maybe, or you missed a module or have to continue with the module, is it possible to rejoin the missed module next month, or do you have to wait for the next semester?
Yep, that's a good question. Yep. So you can take an abeyance during your program. So we understand that things come up, particularly if you're working and have family, and often the things that online students have other commitments. So you can take an abeyance, which is a gap in your studies. What would happen if you decide to do that is that you would get the contact with student support, who would then work out your timetable for when you returned. So you'd need to decide how long you were taking a break for. In most cases, it would depend where you were in that module. If it had just started, you would then wait and do the module when it next started. So I said at the beginning, when I was talking, that we have intakes in January, May and September, and you do whichever modules are running at that time. So we don't run every module every month or even every term. So you would get a new timetable that would show the modules that you haven't done yet in the most suitable order for you. And then if you haven't completed a module, you do that at the next available time. I hope that kind of makes sense.
Yes, I do. I believe it does. Okay, fantastic. Right. So next question is PhD related, interestingly. So someone said they know that we have a PhD in health promotion and public health. So how do these modules fit into that?
That's a great question. So in the UK, a PhD is not a taught program as such. It's a body of research that you as a researcher would develop and perform yourself, and write it up in a big thesis, which typically has about 3 research studies in it. So it's not a case of you have a set of modules, for example, that you need to study for a PhD. The way it typically works is that you come up with a research proposal, you find some supervisors that are interested in supporting you with that, and you either study that through your own funding, or you find some funding to complete that PhD. So yeah, I mean, it really does depend on what you would like to do in the future for a PhD. What we typically see, and my own experience when I did a master's, was that I really got to understand what I was really interested in during my master's, and that enabled me to write a research proposal that I could then get PhD funding or do a PhD for. So it's really interesting to see kind of what your passions and interests were at the beginning of a master's. Maybe will stay the same, or maybe they'll change and evolve as you learn a lot more about all these different topics. So yeah, just to reiterate, so PhD in the UK is not really a taught course, it's a research course that's driven by your own research and study.
Thank you, Emma. Okay, so our next question is, can a registered nurse and other non-degree programs be qualified to be admitted? So I'm assuming she means eligible for this course. There is public health experience for over 20 years as well. So this is somebody with public health experience and registered nurse. Would they be eligible?
Yeah, that's a good question. So we definitely encourage you to apply. So we'd look at the qualifications that you got whenever they were, whatever certification that you have for those qualifications to become a registered nurse. And obviously, yeah, your work experience there is decades long, and we definitely value that. We really value the wide range of experiences that our students come to us with. So yes, please do apply, because you've got a lot of relevant experience that will see you well on this course.
Thank you, Emma. So our next question is not related to any of the programs we are talking about in this webinar. It's an overseas student who's in college at the moment, keen to join Brunel, but wants to find out about the MBBS, which is the Brunel Medical School degree, which we're actually launching not this September, but next September. And the initial intake of students will be international students only. So in that respect, you would be eligible. But what I will say is it's a long course. There's a lot of eligibility criteria, and it's a big commitment. So what I'm going to do is I'm going to personally send you the link to this course. I would read up on that information and then decide whether the course is right for you. In terms of whether scholarships come with that course or not, the link I'm about to send you will have more information on that. I don't think our academics would be best placed to answer any questions related to Brunel's medical degrees. So I'll personally send you a message on that. So back to the questions regarding the public health and health promotion degrees. Is there any age limit for admission?
Great question. No. So obviously, typically students have done a degree of some sort. So they typically be in their early 20s as a minimum. But in terms of an upper age limit, we definitely don't have one. It's all based on your academic and work experience, as I mentioned before. So no.
There you go. Always good to know. Fantastic. Okay, so next question. I think this is kind of asking a bit about the future opportunities that come out of these degrees. So I know we mentioned the career opportunities as well. So I think maybe the person's joined a bit later. Would it be worth just going over some of the potential career opportunities that you can go on to after completing one of our new public health programs?
I can start, and maybe Nana, you want to chip in afterwards, just because you've kind of been running the existing public health and health promotion program. So as I said before, the new courses, obviously, we haven't got a history of students having completed as they've just started, but from our other relevant course, the public health promotion, we see a wide range of careers going forward. So academic careers, so maybe going into PhD or university lecturing, for example, and research, but also across local, national and international government organisations, charity sectors, industry sectors, and yes, it's really broad, as well as different types of industry as well. So it might be healthcare, biomedical, technology. So yeah, I'll see if Nana can add to that as well, but it is a very broad program across these, so that will suit you well for your future.
Absolutely. Yeah, absolutely. You're right, Emma. So normally when I'm asked this question, I always give, I reflect on the number of employers, potential employers that we invite. So we run annual employability events that we run the events on campus, but all our students are welcome to attend as well. And during this program, what we do is that we invite potential employers. And anytime we do this invitation, we realize that many of those are our former students. Now, currently, one of the external examiners of the Masters in Public Health and Health Promotion did our program, and he's a professor at a UK university. We also have some of our former students working with international and national NGOs, working in the NHS, so public health England. So I think with our courses, what that provides you is the breadth of areas that you can jump into after school. And we do also support that with the employability events to prepare you jump into your next job.
Thank you very much, Nana. So that's a very good question, and it's actually a great opportunity to finally say goodbye to you, because Nana has to leave a little bit early. So thank you very much for your presentation, Nana. I don't know if you want to take the quick opportunity to just unmute yourself and say goodbye. We do have a couple more questions for the other presenters. So nope, I think we may have already lost Nana. So thanks for joining us.
Oh, thank you. Thank you all. And keep your questions coming. We are one big family, and we're happy to see you join us. So any questions, I always say that the webinar is just an event. It's a process and not just an event. So any questions, please keep on coming, and then we will do what to answer them. Thank you.
Fantastic. Thank you, Nana. Yes, just to reiterate, that is, if you can't answer your questions today, I'm sure they'll find their way to Nana and he'll get back to you with a response. So back to the questions coming in. So what are the percentage chances of securing a job after the public health program in the UK?
So it depends what you mean by that, I guess. So as I said before, these three new courses are brand new. It depends, I guess, what you mean. So public health job, an academic job. So in the UK, masters, careers post-masters are not routinely collected in the same way that they are for undergraduate careers. So I can't provide you with an actual statistic. and nor could any UK university. But as we said before, the really good thing about these courses is the wide range of careers that you can then choose from, because they upskill you across all of these different dimensions. So yeah, I can't give you a round number, unfortunately, for that one.
Thanks, Emma. Yes, it's very difficult to get figures for PG courses. I mean, Brunel has a very, very strong reputation, and that will definitely hold you in good stead once you graduate. And our universities, what we do offer as well within the universities, worth mentioning, is a department called the Professional Development Center. And after you finish your degree, that department can work with you to kind of polish up your CV, your interview skills. They also have a range of companies that post jobs and everything via that department. So we do have lots of kind of employability support that will help you once you finish your program. Okay, so next question is, okay, so I'll read this out. I said it's sort of tricky. So can you get accreditation for prior learning? So for example, if you have done similar modules in previous MSCs or a first degree in the UK?
That's a really good question. Actually, another applicant emailed me about that just today. So it's actually on the top of my head at the moment. So we only offer the Masters as a full course. You can also do what's called a PG dip, which means you do all of the other modules without a dissertation research project. We don't offer what's sometimes called top-up degrees. So say, for example, you've done a few modules already elsewhere, or maybe you've done all the modules elsewhere apart from a dissertation. We don't offer top-up programs to just get you over that last hurdle. So yeah, if that's what you're looking for, maybe contacting another university might be helpful, or you maybe might be interested in picking one of our courses, which is most different to the one you've done before, to get a different range of experiences in that way.
Sorry, thank you, Emma. Okay, so our next question is somebody who has a third-class degree in medical laboratory science with over 5 years and 3 years working in the health sector and National Public Health Institute. They tried applying to the MPH of Brunel, though not online, but the application did not go through. So I'm not sure we had a Masters of Public Health before the online program, did we?
We don't, so perhaps I'm not sure, and I won't comment on individual cases here, so please either contact myself or admissions. Perhaps you're talking about the MSc Public Health and Health Promotion. If you want to, I'm not sure what you mean by it didn't go through, either maybe it's pending somewhere, or so please either contact me or admissions and we can look into that.
Absolutely, yes. If you haven't heard back from regarding your application, the admissions email address is quite straightforward. It's admissions@brunel.ac.uk. That's admissions@brunel.ac.uk. They can give you an update on your application. If your question means you were unsuccessful and were rejected for the program, then I'm not sure, or maybe Elaine, you can answer this. Are the entry requirements different for the online courses versus
they're all the same across all
okay.
of our courses, whether it's the online one course or our 4 online programs, they're all the same.
Okay, thank you. So yes, so what that means basically is if you haven't heard back from admissions, email them on the email address I mentioned earlier. If you have been rejected and maybe you need some advice on how you can bring yourself up to the level to apply for the future, email the same address. I'm sure they'll forward it on to a relevant academic who'll be able to potentially provide some advice. Is that right, Emma?
Yeah, you're welcome to email me directly as well. I'm the admissions tutor, so that's fine. We can discuss and look into that further. That's fine.
Fantastic. Are you okay if I mention your email address?
Yeah, I can put it into the chat now.
Yeah, it's quite straightforward. It's emma.norris@brunel.ac.uk, which Emma will also add into the chat in a second. Okay, so our next question here. Right, so one question actually I might support the team here. So there's a lot of questions coming up about scholarships. Now, for the online programs, there's no scholarships at the moment. Potentially there may be some for the Campus Public Health and Health Promotion course. To find out about all the scholarships Brunel have on offer, we have a very, very useful tool on our website. So if you literally just Google Brunel scholarships, it will take you directly to the page and not only show you the range of scholarships that are available, but also show you scholarships based on what's available to your country or particular requirements, personal factors and things like that. So I'd recommend, rather than saying going through all the lists and saying a general yes or no to whether scholarships are available, please visit the Brunel's website, and there's a really detailed section there about scholarships and what's available for your region. Okay, so next question is, you said there are recorded lectures, but what happens with the interaction between different students? Okay, that's a good question.
I can answer that. So there are recorded lectures, but we also have the discussion forums and different types of activities that you do during the week. And that's where you can interact with other students. So you can ask questions there, you can discuss the topics. You can also message other people using our online platform. So if you particularly want to speak to someone or raise a question, you can either do that to your module lecturer, or you can also message other students. And that's also why we have the live sessions as well. So that can be a Q&A session. It might be a presentation of something, but then you can ask questions. So we try to encourage as much interaction as we can. It tends to be more asynchronous, as I mentioned before, so not necessarily in real time, because that allows for the fact that people are all over the world and might be studying at different times, but it is a way for people to interact with each other. And we continue to look at different ways of doing that. So there might be some new ways of doing that in the future, because I'm thinking of one at the moment that we're planning to introduce soon, but haven't quite yet. So we're constantly looking at the way that we do our learning and our teaching, and you should be interacting with other people. It's just in a slightly different way than you would on campus.
Thank you very much, Elaine. So we are actually at the end time now, but we have a couple more questions. So Emma and Elaine, would you be around for another couple of minutes, perhaps?
Yeah, that's fine.
Yeah,
Yep, sure.
fantastic. Let's have a go at that. Okay. Whoops, I seem to have lost my screen there. Okay. Just so, could somebody please do a quick summary about the Global Public Health MSc again?
Yes, so the main differences are, again, here in bold, are the two main modules that are different in this course. So it's really focusing on the social justice perspective in terms of how racism, sexism, and other privileges in our society affect our health. So that's on an individual level, but also on a wider community and national level as well. So that pulls in evidence globally, which is epidemiological, for example. So seeing how the effects of these privileges exist over time, but also thinking about in terms of global public health, so the other side of this master's, which is really thinking about how you can develop initiatives and lead teams that are really effective at the global basis. So really focusing on global in the sense of perhaps you're based in a country other than the UK, but perhaps also maybe you're coordinating teams that are based on an international basis. So the two modules that are different are social justice and health, and leadership and change for global health in that master's.
Thank you, Emma. So we have 3 more questions left, and we will conclude with that. So we'll take the last 3 questions, and then we'll conclude the webinars. I believe you answered a lot of questions today, and we've given a lot of great detail. And if you missed anything, don't worry. We have your registration details. So after the webinar is over, you will receive a recorded video of today's webinar. So last couple of questions. Is the Masters of Public Health internationally recognized?
A good question. So yes, that actual qualification title of MPH is what we have found a lot of students internationally want from a public health master's course. So we've taken a lot of care to ensure that the modules that we include cover the wide range that's required for accreditation. So we're currently applying for accreditation for this new master's course. To do that, you need to have already been running the course. So we're in the process of applying for that. And we have the full range of modules that really we need for that accreditation process, which includes leadership, that is crucial, behaviour change, epidemiology and research methods, etc., as well as a dissertation. So we currently don't have a formal accreditation, but we have designed this to meet a lot of the needs that will require the accreditation. So hopefully in the next few months we'll have that accreditation, and you will obviously take that forward. Many jobs and many careers don't require an accredited course, the fact that it's from a recognised university is sufficient, but some students just like to know that it's accredited by an outside body. So we're working towards that at the moment now that the course is live.
Thank you. Right, so is there disability support for online students? So somebody's currently studying at the Open University, and they've provided printed materials and a support mentor. Is there any such support available like this at Brunel?
So I can take that one. Yes, is the short answer. So when you apply, I think on the application form, it asks you whether you have any additional support needs, but you can also declare that at any point later. So we have a disability support team who will go through almost an interview or a discussion with you about your needs. You need to provide evidence, but they will then create a support profile for anyone that has additional support needs. That's then passed on to the program team, who can then make any reasonable adjustments that they suggest within your support profile. Generally, we find, though, that for our online studies, most of what we're asked to do is already happening anyway. So, for example, the handouts, with all of the recorded videos we have, we already accompany that with a printout of the script. All of our materials are online and available in online sources. So our reading list is all online, so you can use that. We've also got subtitles in our videos as well. So we've really tried to make the programme accessible to a whole range of people, not only for those who might have support needs, but also for people that just learn in different styles as well. So we all have different ways of working and learning. And so we've just tried to really cover all of the bases in our programme. But yes, you can go through the disability support team, you create a profile, and then we'll sort anything out that you might need.
Fantastic. Thank you very much, Elaine. And just to kind of add a little bit onto that, is we have about 10,000 plus students on campus who have various needs of support that they need, and we're very experienced with dealing with any kind of support and issues that come about. So rest assured, Brunel will take care of any needs you have. So the next question, and I think I'll kind of semi-answer this, but correct me if I'm wrong. Somebody's concerned that the research project, the dissertation, requires additional fees, but I don't believe that's the case. I think the course fees cover all the modules. Is that correct?
Yes, I'm wondering if this person's referring to costs of running research. I think that might be, so maybe you're thinking of I don't know, trying to pay participants or something as part of that. So we encourage, there's a wide range of research that you can do for free. Most of the research around public health can be done for free. We're not asking you to run interventions, for example. Typically, students do things like run some sort of survey, do some interviews, or maybe look at some secondary data analysis, or perhaps do a review of a body of work. So all of those things can be done for free. So I think that's what you're getting at. So just to reassure you that there's no additional costs associated with doing that.
Okay. So another question, and I think we'll make this our last question because the other ones are areas we covered already. So the final question, is it possible to cover the Public Health and Health Promotion MSc in less than the 2 years?
Yep, we run either over 1 year or over 2 years. So the minimum you can take is a year. I think any quicker than that would just be impossible to take it faster than that. So 1 year, or we offer 2 years part-time. So there's both those options.
Thank you very much. And I think on that note, we shall conclude today. So I hope you found the session really useful. We've gone through a lot of questions, which gives a nice rounded perspective to the webinar. And this is not the final opportunity for you to ask questions. You can see the application link on our chat section. So if you go on there, there's also a contact us section. So if you need to ask further questions, you're more than welcome to contact us. And again, just to mention what I mentioned earlier, is that a recording of this video will be sent out to everyone who registered for the event. So you'll be able to go over it again and just see information. And again, you know, all the web pages we have on the Brunel website as well, they offer lots of detail, not just about the course itself, but studying at Brunel and all the support available. So thank you again for joining us. If you're ready to apply for one of our online public health programs, you can do. Again, the link is on the chat section and it starts with enroll.online. So before I conclude, I'm just going to hand the mic back to Elaine and Emma to say a quick goodbye.
Yeah, thank you very much for your time today. As John said, we are here for any further questions, and you have my email address, so feel free to use that, she said. Thank
Echo what Emma said. It's been lovely to have so many of you here. It's great to see your questions and your interest in the programme, and I hope to see some of you in the programme in the near future.
Fantastic, thank you, Elaine. So it's a goodbye from Brunel University and myself. So please stay safe and take care of yourselves. Goodbye.